Hey everyone, let us begin today's video with a short poll. Are bleeding gums normal? Yes or no? Leave your response in the comments below. Studies found that 1 in every 3 people believe that it is normal for gums to bleed. But the truth is, this is not normal. Bleeding gums affects around 60% of people all over the world. This blood indicates you're probably doing something wrong. Let us look at 10 common causes of gum bleeding. The accumulation of plaque, usually caused due to poor oral hygiene, causes inflammation of the gums, which is also called gingivitis. This is the top cause of gum bleeding. If this plaque is undisturbed for a prolonged duration of time, it slowly starts to calcify, causing damage to the gums and the adjacent teeth. This condition is called periodontitis. This is an infection of the periodontium and may be accompanied by gum boils, which could discharge pus. The gums bleed on the slightest touch due to severe inflammation. This damage could be irreversible, so pay attention to your dental hygiene. Using a worn out toothbrush can traumatize your gums, so remember to change your toothbrush every 3 to 4 months. Certain medications can cause the gums to bleed due to inflammation. NSAIDs, antiplatelets, blood thinners, and anticoagulant medicines may be responsible for the gum bleeding. Do not stop any medication. Bring it to the notice of your doctor, who will decide if any alterations can be made. A poor diet may lead to deficiency diseases, of which the most commonly associated with bleeding gums is scurvy or vitamin C deficiency. It causes redness and swelling of the gums, accompanied by bleeding at the slightest touch. It eventually causes the teeth to get loose and they may also fall out. Deficiency of vitamin K can cause a failure to clot, so make sure you're eating a balanced diet. Use of ill fitting appliances such as retainers or orthodontic plates, removable partial dentures, or complete dentures all may lead to repeated damage to the gums, resulting in bleeding. Flossing is very important. However, improper use of dental floss can cause more damage by hurting your gums. Pregnancy is a condition where there are lots of hormonal changes in the body. This may lead to inflammation of the gums, which can result in bleeding. It is important to maintain good oral hygiene throughout. This condition usually subsides when the pregnancy ends. Trauma or hurting the gums and teeth can cause bleeding. A blow to the head, eating something extremely hard, or forceful brushing could cause dental trauma. The last cause we look at is bleeding disorders. Conditions such as hemophilia and other platelet disorders affect the clotting mechanism of blood, which predisposes affected individuals to bleeding gums. Another condition is leukemia or blood cancer, which also has adverse effects. Some other signs of gum disease include swollen gums, receding gums, loose teeth, and bad breath. Let's quickly look at some ways to prevent gum bleeding. Brush using a soft toothbrush at least twice a day. Use a fluoridated toothpaste and follow a proper brushing technique. Floss daily. It is extremely important as floss reaches places your toothbrush misses out on. Religiously replace your toothbrush every 3 to 4 months. Live a healthy lifestyle and consume a balanced diet. Quit using tobacco and cigarettes. They cause oral cancer. And lastly, maintenance is important. So remember to visit your dentist every 6 months for a checkup. I hope this video has taught you everything you need to know about gum bleeding. Don't forget to share this video, hit the like button and subscribe to our channel.